Our Tao from the Ministry of Foreign Affairs will be answering questions you may have. Please allow me to remind all participants that if you want to ask additional questions during the Q&A session, please click the chat button below and type your full name, position, and organization. The MC will ask each participant to speak, and the moderators will answer the questions accordingly. Before we open the Q&A session, we would like to first invite Mr. Phil Ramos, Deputy Majority Leader of New York State Assembly, to say a few words. Mr. Ramos, the floor is yours, and please remember to turn on your microphone before you speak.
Okay. Can you hear me?
Yes.
Can
Yes,
you hear
we
me?
can hear you.
You can. Okay. Well, first off, I want to thank you for the invitation to attend this seminar, which is very informative. I'm Deputy Majority Leader in New York Assembly, and we have been hit very hard over here. And just looking at your presentation, I see parts of it that we could definitely learn from. And I want to thank you for presenting that to us. Hopefully, down the road, maybe through people in your economic section over here in New York, perhaps we can get copies of your presentations. That would be very helpful. I don't have any questions, but I want to thank the Taiwanese government, because today they came out to my district and made a donation of a significant amount of PPE for local hospitals who are really stretched. So I want to thank you from the bottom of my heart. It's not often we see, actually in my lifetime, that I see other countries coming to help us in our time of need. And Taiwan has been one that has been consistent to that, and a great friend, a great partner, reciprocal, very conscientious, and understanding in that, we learn more from each other, and we certainly have today. So I want to thank you all again for the invitation, and looking forward to hearing more about it.
Thank you, Mr. Ramos.
Thank you.
Now, we would like to first invite Dr. Yuqin Zhang to answer the questions submitted before.
Okay. Good evening, everybody. Again, it's a privilege and pleasure to have this opportunity to share these action items that have been implemented in our hospital. And hopefully the effectiveness of this action could be beneficial to all of you. Some of our participants have sent their pre-meeting questions by emails beforehand, and I integrated some of the questions and summarized into these two slides. The first slide is a briefing about what we consider to be important aspect of the epidemic prevention that contributed to the success of our fight against this COVID-19 pandemic. Our government and our hospital share the same principle in facing COVID-19 pandemic: fast, fair, and transparency. The first principle is fast, based on the lesson we had learned from our SARS experience in 2003. At that time, Taiwan was among the worst hit territories. Taiwan government established a public health response mechanism to enabling rapid action for the next crisis. Well-trained and experienced teams of officials were quick to recognize the crisis and activate emergency management structure to address the emerging outbreak. Therefore, precaution to contain the spread of this coronavirus was taken quickly. In our hospital level, drills for emerging infectious disease are essential for our periodic national hospital accreditation. Relevant measures had already been internalized. No sooner had we got the information, even beforehand the instruction or regulation from our government, we rerouted our patient flow, set up temperature monitoring system, TOCC checkpoint in the front door. And outdoor examination counter for patients with fever and or TOCC history to contain the spread of the virus in our hospital. Go ahead of others, we adjust manpower to prevent cross-infection among our personnel and activate isolation ward for COVID-19 patients. The second principle is fair. First of all, our national health insurance system promises and provides fair medical treatment in every citizen in Taiwan. Patients with suspicious symptoms can be assessed quickly. Also, in the beginning of the epidemic, our government took over the mass production line and implemented the mass rationing plan, which gave people an equal amount of masks to prevent stockpiling. You know, Taiwanese people know wearing face masks is a practical way to protect themselves. Due to the experience of battling against SARS, people got protected by this mask and thus become less panicked. Also, during this period, our government has regulated that people who enter a hospital must have their mask worn, regardless of the type. So everyone wears masks in the hospital, and the health practitioner also get protected. In hospital level, soon after we had inventoried our epidemic prevention material, we set up a clear PPE policy for our fellow workers, according to the risk of the coronavirus exposure in a working environment. Under this PPE policy and the surveillance of department leader, every hospital staff was involved in this battle, as we say, total involvement. The third principle is transparency. Routine press conference every day hosted by the Central Epidemic Command Center give an update on the current state of COVID-19, either inside our country or worldwide, and open the floor for questions. For the past few months, it has become the most popular live broadcast in Taiwan, and some people consider this to be the nourish for their mind. There is also a direct phone line for instruction if people have any question. In hospital level, we hold a routine leadership meeting weekly for intra-hospital communication and policy or decision making. Conclusion in the meeting will be revealed in our hospital intranet for reference and open to every hospital staff. All information thus become transparent. And no fair and transparently, no dispute. And everyone is aware of their essential role in this battle, so we can work together with one heart. In addition, we are fortunate to have strong support from our community, along with many digital social innovation. Since the outbreak of COVID-19 pandemic, Taiwan government has activated many measures to contain the spread of the virus and minimize the damage, like border control, PPE production line control, home isolation, mandatory quarantines, and so on. But we had never locked down any city or town. There were restrictions on the number of people allowed in a place where when they go out or attend social activity. The students in Taiwan go to school as usual. So our economy was affected but not defeated. For the past few weeks, the Central Epidemic Center has gradually removed disease prevention-related restrictions as Taiwan coronavirus stabilized and the community are relatively safe. This is the recent poster from our Central Epidemic Command Center, urging for a new lifestyle for epidemic prevention. They reminded people of observing personal preventive precautions, including washing hands frequently, wearing masks where social distancing can be followed, or installing protection if possible. They also announced guidelines for the contact information-based measures for COVID-19 to protect personal data and facilitate outbreak investigation. The CECC stated that if Taiwan continues to record no new indigenous cases or no community transmission after June 7th, they will expand the scale of loosening epidemic control measures and restrictions on daily life. In future, we will continue to adjust related disease prevention measures, but still keep alert, depending on the result of the relevant risk condition. We believe COVID-19 may be seasonal, numbers may be accelerated in the fall. So this is my brief summary for the previous mentioned question. And now I will ask my colleague, Vice President Dr. Zhou. There's a question about the air purifying systems that are being shown to be effective in reducing COVID-19 transmission, and he can give us more details.
Good morning and good evening, ladies and gentlemen. I'm pleased to give a brief answer to the question that is regard to the air purification to prevent the transmission of COVID-19. In our hospital, patients with confirmed or suspected COVID-19 infection are isolated in negative pressure rooms. However, since there are limited number of negative pressure rooms in our hospital, we have made adjustment of air conditioning system for all rooms at the one patient floor to be negative pressure by blocking airflow from patient room back to a central airflow. Then as a result, we have the entire floor to be isolation rooms to accommodate more COVID-19 patients. And as regard to the purification of air in air conditioning system, we use HEPA, where only PM 2.5 particles and bacteria can be filtrated, but not viruses. Theoretically and practically, we can install a UV light in the airflow system to kill coronaviruses. But we did not do so because it is not considered cost-effective. And as you know, that the transmission of COVID-19 disease are believed to be through droplets in contact with contaminated objects rather than airborne. So it is most important to wear a mask, do frequent hand washing and disinfection of environment for preventing spread of disease instead of purification of air. Thank you.
Okay, thank you, Vice President Dr. Zhou.
Thank you, doctors. Before we ask Mr. Howard Tsao from Ministry of Foreign Affairs to answer questions, now we would like to invite Ms. Yulin Niu, member of the New York State Assembly, to say a few words. Ms. Yulin Niu, please turn on your microphone before you speak.
大家好，谢谢你们今天还花那么多时间跟我们就是表达你们的专业的事情，因为我们知道我们在美国其实没有你们台湾办得好啊，所以我们今天学了很多。Yeah, I just wanted to say thank you so much for sharing all of your experience and knowledge with us. As you know, we really look up to how Taiwan has actually handled the crisis because in America we actually have over 100,000 deaths. And that is a lot of people that we've lost. And so I wanted to say thank you so much for sharing your time, sharing your expertise. And I'm learning a lot from all of you and really appreciate the process in which we can help to get our healthcare system prepared for the future. Because I think that one of the things that I really learned was how much flexibility a lot of your spaces have. And a lot of your people have in responding to emergencies. So I think that it's a very incredible thing to listen to and learn from. So really, really, really appreciate it. 真的很感谢大家。谢谢。
Thank you, Ms. Niu. Now we would like to invite Mr. Howard Tsao from Ministry of Foreign Affairs to answer questions submitted before.
Thank you, Gary. So before I start, I'd like to say that last year we were happy to receive in Taiwan the former governor of Mississippi, Bill Bryant. And of course, we hope that next year or whenever travel restrictions are lifted, that the current governor of Mississippi would come and visit us again. So I'd like to address some of the questions that the participants have put forward. Let's start with Karen Timmons from the CEO of Global Healthcare Accreditation for Medical Travel Services. She asked a question regarding special protocols or precautions for travel patients once travel restrictions are lifted. Before we touch on that subject, travel restrictions, that's where I like to start because travel restrictions has been imposed early on travelers coming from China. And on March 18th, we banned all foreigners to come to Taiwan, except for foreigners with ARC, the alien residency certificate, or businesses or people with special permits. But now as countries start to reopen with the abatement of the COVID-19, travel bubbles have become the hot topic for the coming months. So because of the success of Taiwan in dealing with COVID-19, including Guam and Hawaii are considering, or in fact, the government of Guam already announced the lifting of travel restrictions for Taiwanese, Japanese, and Korean travelers to Guam. So in the coming months, the Ministry of Foreign Affairs will work in conjunction with our CECC to determine basically what we will do is report the cases of COVID-19 back to the CECC, and they will determine the risk levels for these countries. And depending on the risk levels, we will start opening and easing restrictions on travel for these countries. So. I'd like to tackle another question by Mr. Robert Parker from the law offices of Robert Parker, PC, who asked, if Taiwan is not a member or observer of the WHO, does it have a liaison relationship with Singapore or US that permits it to transfer and receive health information to the WHO? In fact, even though we are not observers to or members of the WHO, we do have a contact under the IHR mechanism. And in fact, it is through that IHR mechanism, the International Health Regulation Mechanism under the WHO, that we sent an email to the WHO contact back in December 31st, when we gave an early warning about COVID-19. So we have direct contact with IHR. However, that is not nearly enough, because ever since this current administration came into power, the WHA has stopped inviting us to participate as an observer in their General Assembly. This is, of course, harmful for global world health, and is a detriment to the 23 million people in Taiwan. And another question by Angela Cassidy from the Ben Franklin Academy asked that, do you feel that Taiwan and China have had an easier time dealing with pandemic than the United States, in that there is a one-party controlled government versus a democratic government with many conflicting voices? And on this topic, I'd like to expand because, in fact, Taiwan has been a fully fledged democracy since our first election back in 1996. And we have open and fair elections. We have had multiple transfers of power. And I think this COVID-19, we can see the stark contrast between China's and their way of dealing with COVID-19 and Taiwan. In Taiwan, as I believe our doctors and Vincent already said before, every day since the establishment of our CECC back in January 20th, there have been daily press briefings on what the government is doing and the measures that we have taken to counter COVID-19. And the public has been very accepting of the government's position, because the government is being held accountable. However, in China, where they have more than 80,000 cases and more than 4,000 deaths, they basically shut down the flow of information and created a very stringent restriction on their own people. I think it is in part because that we are a democracy and we have open and fair and transparent laws that we have been successful in dealing with this COVID-19. And of course, it is also thanks to our doctors and our frontline responders and our members of the CECC who have been very diligent in tackling this issue.
Thank you, Mr. Zhao. And we do have some additional questions from a few participants. First, we would like to invite Mr. Anthony Weeks, Economic Envoy to Taiwan from the U.S. Virgin Islands government, to ask his questions online. So, Mr. Anthony Weeks, please turn on your microphone before you speak. Thank you.
Hi, good evening. Can you hear me?
Yes. Yes.
Okay, so I posted a couple questions, but I think specifically, we are here in the United States, as we have we started the process to phase reopen the economy across 50 states and territories. The issue of testing and contact tracing are the two primary challenges that we have. Obviously, we see the debate between the federal government and the state governments as to who pays for that, and obviously hiring the manpower to do the contact tracing and the use of technology. And I was wondering, how would you describe Taiwan's position as you looked at the role of wide testing, employing to wide testing, as well as combining that with contact tracing? Were they exclusive of each other, or could you do one without the other?
I think I can answer this question. So, here in Taiwan, it was done combined, so contact tracing and also widespread testing. But as I've said before in my talk earlier, only the patients that we have suspected contact or suspected symptoms were tested. That way, we don't waste our capacity for testing. So only doing a single one, only doing contact tracing, or only doing testing would probably be not as effective as both combined.
And just to finally piggyback, there's the challenge of Americans accepting the use of technology for contact tracing. Did you get a lot of pushback in Taiwan? Did citizens of Taiwan, were they willing to participate in the use of technology for contact tracing?
Okay, so actually it was, there was, of course, because privacy is a very basic and important human right. So there were citizens that were very concerned about the implement of technology in contact tracing. The way that it was done here was very clear communication, transparency about for who it is done, how it is done. So I've even read reports from international reports that say Taiwan is doing very stringent contact tracing, which is completely not correct. It has to be done under the consent of the citizen. There has to be rules and laws that have to be followed. So in general, it is the public, the person being willing to receive contact tracing. And because of our experience with SARS, that's the main reason why we received less pushback, because that our general public knows that by accepting contact tracing, they are protecting themselves, their community, and their country.
Thank you very much.
You're welcome.
Thank you, Mr. Weeks, for your questions. Next, we would like to invite Sean Liu, Legislative Director from New York State Senator John Stew's office. Sean Liu, you may have the floor, and remember to turn on your microphone before you speak.
Hi, everybody. Oh, hi, sorry. Yeah, I was wondering if you have any, some of this has been asked before, but if you have any specific strategies, because here in New York, we weren't able to contain, like quite as successfully as Taiwan did. And so we don't have a border now, to really kind of control some of the infection and spread quite the way that Taiwan has. So, is there any lessons that you would say that you would advise in terms of what are the policies going forward as we look to recover from the pandemic, and really kind of minimize the effects of a possible second wave?
Taiwan is very lucky to be an island country. That means that we have a natural border. Without a border, and also with COVID-19 having asymptomatic transmission, it is very hard to prevent a second wave. Opening up is also a very hard issue, even here in Taiwan, where we have very minimal but proven locally acquired cases. I personally, this is not any other. Personally, I think that a second wave is very hard to avoid without a vaccine or maybe herd immunity.
All right, thank you.
Did that answer your question?
Oh yeah, no, I was just wondering if you had any, particular experiences that, you would give us in terms of advice on, like, what are the things that you would suggest going forward, right?
Well, from a healthcare perspective, I think that would be teaching the general public about not going out if they have any symptoms, any coughs, colds, or any fevers, not going to public spaces with that. Hand washing is something that that even before this pandemic, something that the Taiwanese public has been taught for public health issues, and also, which I know that there's a major pushback in America for some parts of America, face mask wearing, which is important, and it's done very well in Asian societies, but in America, I know that there's a pushback against that.
Oh, and I'm sorry, I asked this before. Is there a space for antibody testing, and like what is it best used for?
Antibody testing was used in Taiwan when there was a outbreak on one of our Navy vessels. So we used antibody testing to see how many of our sailors were in contact or have been infected, because they were on the Navy vessel, the warship, for an extended period of time. So maybe there were some sailors who already were infected and healed themselves. So I think antibody testing right now has less importance, because we are still not sure if people who have been cured or healed from COVID-19 are, first of all, totally immune, or second, if they can transmit the virus even if they are antibody positive. So for a test, when we do a test, we want to know what we can do after the test results. If I see a patient who is antibody positive, I would want to do a RT-PCR to see if there's any viruses in their body. But without antibody testing, if there's a patient who has contact history, or if there's a patient who has symptoms, I also want to do RT-PCR. So the golden standard is still RT-PCR. So antibody testing would not change whether or not I want to do RT-PCR. So if there's a patient with TOCC history or with symptoms, I would want to do RT-PCR. So the importance of that would be less.
Okay, thank you so much, and thank you for everything that Taiwan has done to help us. With your donations, you guys have been so generous, and thank you for putting this together and helping to drive the discussion and give us advice on how we could figure out this pandemic.
You're welcome.
Thank you, Mr. Liu, for your question. Last but not least, let us invite Ruben Malloy, officer from Department of Health from U.S. Virgin Islands, to ask another questions. Mr. Ruben Malloy, please remember to turn on your microphone, please.
Good evening, everyone. My question was answered in the chat. My question had to do with how did you account for asymptomatic individuals in preventing a second wave of positive individuals?
Yes, so it seems like with asymptomatic transmission, contact tracing would be most important. So that's why in the beginning we implemented a travel, occupation, cluster, and contact checks outside our hospital, at the door of our hospital, because without these contact tracings, we would not know who could be a asymptomatic transmitter. But in the case of a major outbreak, such as in places most hard hit like New York or so, I would say most likely all of the general population should be considered with positive contact history. That means the way to go forward with that would be assuming everyone is capable of transmitting this disease. So the way to do that is to have what already you are doing, that's social distancing, that's washing your hands, that's, if possible, covering your face with a face mask, surgical mask, not a 95 respirators, which is only beneficial for healthcare workers.
Thank you, Mr. Bongoy. Dear participants, since there are no other participants who would like to ask additional questions, we will lastly like to invite President Wang from Taiwan Adventist Hospital to say a few words.
Okay. Thank you for your participation. The meeting comes to the end. And as we know, we are in the case of the COVID-19 storm, and we are on the same boat. So we do work together and help each other out. And on the other hand, we should take precaution to the resurgence of the COVID-19 disease after reopening and the travel ban lifted. So if you have any more questions, we are willing to answer. So you may contact our window. We will give you the answer. Thank you for your participation, and may God continue to bless you. Thank you.
Ladies and gentlemen, this seminar now concludes. Thank you all for joining us today. We wish you have a fruitful meeting, and please do feel free to contact our offices in your relevant jurisdictions for further information. Have a good day.
Thank you. 谢谢。
谢谢院长，谢谢。